if you want. What is up, Z?
Whoa.
Almost fell out my chair, dude.
Unbelievable.
This is already, we just went live and it's already an epic fail.
Yep.
Z-Pack, I am super, super excited. We're going to wait because we're live, but I have no idea if anyone's actually come in yet. There we go,
Right.
5 people. 5 people coming to see the newest member of Team Z-Dog MD. This is Andy Loynd, people, our new executive producer. Y'all remember I was searching for a person who could help take the game out of whatever game we were playing to the next level. It's this guy. It's this guy. You know why? It's the tie. It's the suit that I made him wear.
It's the badge.
It's the badge, which I also have one. It's all backwards. Actually, watch. Look at this. This is the magic of this, Andy. The magic of Facebook is we can fix that.
So are we live right now?
In post. Yes, we are. There it is. No more mirror image. Hey, I like this better.
Hey, nice.
This is better. It feels more natural. 154 people. I think we should get started. So, guys, we're in San Antonio, Texas for the Texas Medical Association annual meeting. I am the keynote.
Big deal.
It is a big deal.
It is.
We were wandering around earlier, and there's all these fired up Texas docs who are like, fight the power. It's time to take back medicine. It's time to figure out how we can transcend the assembly line of Health 2.0 and build a better system. And so my goal today is to fire them up about that and also give them an opportunity to interact with us. Use our platform that we've built together, Z-Pack, to reach lots of people, to show them bright spots for Health 3.0. And that's where Andy comes in. So Andy Loynd, and I put his email, andy@turntablehealth.com, in our signature. I'll also put his LinkedIn address after the fact because I couldn't figure out how to do it because I don't know. I don't understand LinkedIn.
Yeah, that's what I'm here for.
Business people. I don't understand it. So Andy was at Up to Date. Y'all know Up to Date for what, 7 years?
Just about.
And then what happened? Why the hell did you come work with us?
Well, Z, that's a great question.
He asks himself every morning when he's like, why did I come work for this guy? He's bald. He's creepy.
Yeah.
I'm in a hotel room with him in Texas.
Yeah.
And I'm uncomfortable. Me 3.
Let me put it this way. So being there 7 years, right, and experiencing healthcare IT and all of the stuff that's going on out there, there's a lot of people talking, a lot of solutions being put out there, a lot of people at podiums, a lot of companies coming up with the next thing, but I don't really see a lot happening, or I wasn't seeing a lot happening. When I saw you, I saw a voice that was conveying some really important, very, very serious, topics and issues, but in a hilarious, engaging way. And I said, I want to be a part of that. So, I reached out when you put that thing on LinkedIn, and I think it's, big things to come. I think the Health 3.0 mission is an important one.
So what I love about Andy, and you can kind of tell already, is he actually understands what it is we do, because working in this space for so many years, he sees it. Like all these companies are talking about AI and lean processes and population health, and he knows all the catchphrases because he's had to sit through it for so many years. And I think you saw EHR State of Mind.
Actually, during my work at Up to Date, spending a lot of time on LinkedIn, a physician executive had shared that video, I think 2015. Something like that, and I watched it, and I said, this is brilliant. This guy's legit, whoever he is. And so I sort of followed you and watched some of the other videos, and your name had come up, online and whatnot. But I think, when you had reached out, I said, this is an opportunity I want to capitalize on. I think I can offer a lot. So.
The great thing, too, is that we were looking for somebody who, because me and Tom and Logan, right, we're the creatives. But we've also had to do the business side of it. So we've had to figure out, how do we get sponsors that are enlightened, that are aligned with our vision of 3.0? How do we get good guests? Because we're so busy making content. Like we're busy filming The Joint Confession Part 2 or Ativan music video or Meet Virginia. And yet I have to take phone calls with like business people all day about, well, our sponsorship opportunities are this and that. Now, the nice thing about Andy is he understands the creative side, but he also understands how we can actually really, really, really help companies and small businesses and organizations and individuals who are trying to reach the Z-Pack because we're aligned with a vision of transforming healthcare. So Andy's with me at TextMed because he's going to talk to people, talk to companies, and try to spread the vision, because as we grow as a platform, it means we can accomplish more in the world in terms of transformation, in terms of catalyzing change.
You know what's frustrating for me, though, is I can't walk 20 feet with you down here without somebody coming up and taking a selfie or asking for an autograph or just hugging you. I mean, it's quite it's annoying, Z.
You know, it's not easy being an international superstar.
Yeah.
It really isn't. Yeah, you should try it sometime.
Yeah.
Yeah.
Hopefully I'll catch a little just by default, just by association. I'll get a little bit of
and the great thing about Andy is he's based in Boston, right?
Yeah, just outside of Boston area.
Where'd you grow up?
Grew up in West Concord, Massachusetts, about half an hour outside Boston. So
this is
uptight New Englander right here.
There it is, except when you're not.
Yeah.
But yeah, I was like, Andy, could you wear a suit and tie?
This is going against everything that I was trying to leave behind.
I know. He's like, I'm leaving the corporate world to be cool, and you're making me dress like this. I'm like, I'm not making. I'm gently recommending that if I'm going to dress like this. Yeah. Then I need somebody to look better than me, and that's gonna have to be you. Let's read some comments. Tell me why. Okay, hold on. What are people saying? Hello from Alexandria, Indiana. That looks like a nice hotel suite. Jessica Basham. I want to thank the Texas Medical Association. They gave you a room too, but it's tiny.
Yeah, it's a standard room.
But I'm an unstandard individual, so. Let's see. Is he single? Asking for a friend, Lisa.
I am not. Married with 3 beautiful children.
His kids are really, really, really beautiful, by the way. Andy he's the reason we liked him is he's a family guy. He's also able to get deep down and developmentally delayed with us when we talk smack.
Yep.
But he can pull it together. He can weaponize his own special brand of autism.
Yes.
And spread it around the world. But what we love is that, again, all his experience in medical education through Up to Date can now be brought to bear with a new, really transformative platform, which is what we've built together, Z-Pack, you and us. We love Z, says Patricia Margaret. Isn't that nice?
That's nice.
Reach out to me, says Davida Loca.
Oh, Davida Loca.
Living La Vida Loca. Texas doctors lack empathy, says Tina Walker. We need younger docs in Texas with a sense of humor who actually care. Tina, I'm going to disagree.
What's empathy?
I don't know what it is either. I can't feel it. I don't understand it. Tina, I'm going to disagree. We just met the president of the Texas Medical Association, and he was a kind, caring, funny, empathic guy who does ballroom dancing.
He wanted to ballroom dance with you, which I found to be interesting.
It was very un-Texas. It was more sort of an SF vibe that I was getting out.
Bay Area thing he was showing.
Get a rope. Yeah. Let's see. Adam Nally says, very cool, watching you closely.
All right, Adam. What's your last name?
Nally.
Okay.
Be aware, because when you get the rabbit head boiled rabbit in the pot, a la Fatal Attraction, you'll know it was Adam. Let's scroll down and see some more comments here. Immunizations and tinfoil, look what you created. Rex Latham. Yeah. Let's see. I have amazing docs in Texas, San Antonio and Fredericksburg. Kelly Bonick. Oh, whoa, look at that. Brett Fencer. Just went, popped in and popped out. I went to school with that guy, man. He's awesome. Do you guys need any nurses, Mindy Hesse? Yes, we need nurses on the front lines who are actually building Health 3.0 by spreading the news, by sitting in the staff break room and going, you know what, we're not going to take being treated like a balance item on a hospital balance sheet. We are going to be the people who are at the front lines of the return of relationship-based medicine.
Yep.
Andy understands this because you're in the business world. So you hear everyone talking about, well, we have to build a better technology to support artificial intelligence. We need this and that. Well, why do we need that? Right. Not because it's a destination. Because it's a stepping stone to rehumanize what we do, to allow us more time to have face-to-face with our patients, more time to actually know what is unique about them. And then the technology takes all the crap that we don't want to do off our plate. That's how it should be. It's not that way now. Now we exist as clerks to serve the technology. And part of the mission of this whole platform is to transform that. Danette Zoll Stratman says, we love you already, Andy.
Oh, thank you,
Isn't that nice? So he's being nice right now. He's actually being very professional. Yeah. Pretty soon we will get him to be less nice, especially to the people who would have us be cogs in the matrix of assembly line medicine.
And they're out there. There are a lot of them out there.
Well, you're in Boston, so you probably see that on the daily. Mass General's out there, some of the oldest schools, right? But then our partners, Iora Health, who helped us run Turntable, are out there.
Rashika was awesome. Met him in Vegas last week.
Rashika's the CEO, founder of Iora, was our partner at Turntable. Really, really awesome guy. So one of the reasons, so Andy, how available are you to talk to people if they want to partner with us on the show, if they want to be a guest on the show, if they want to, how can they reach you? What's the best way?
So absolutely use my email, reach out to me. That's going to be my life, Z, as you know, as I'm trying to get get things lined up with organizations, with people that want to join the Health 3.0 message, and I'd be happy to speak with anyone who wants to explore that. Would be really excited to do that. So yeah, please reach out to me. I think you said you put my email?
Yeah, your email's there. I'm going to put your LinkedIn. So definitely LinkedIn. Follow him on LinkedIn, because Andy posts a lot of our stuff. And he is going to be the contact that handles all the business side of what we do. So it'll take that off my plate so that I can focus on being with you guys, generating content, and staying sort of being able to hopefully transcend a little more of the day-to-day issues of how do we make this a growable enterprise that's going to scale. He's going to do that. And he needs your help. He needs introductions to organizations, to health systems, to companies, to anybody who we think we want to spotlight on the show. And we've done sponsorships with other companies that are great before, and we brought their message to you guys, people like Board Vitals that had a really great outcome connecting with nurses and helped us sponsor Meet Virginia.
That was amazing, like 4 million views in 4 days, something like that.
Yeah, now it's at 5 million, and they gave away something like 2,000 shirts to nurses saying, trust me, I'm a nurse. It was tremendously successful. And the great thing is we believe in what they're doing. They're helping nurses and doctors and medical students and dentists and other people pass their boards and pass their tests so that they can focus on actually taking care of patients, which is great. Right. Brandy Sierra says, come back to California, Z. Stay tuned. You never know what could happen, although I like Vegas. Tom Heineber.
Okay. Oh my God, Tom! What did he have to say?
Anything Danette is just saying Tom Heineber. Maybe he's on here. I bet he is making comments at Punk. Who else wants Dr. Z on Dancing with the Stars? Says Aaron.
That's a phenomenal idea.
Should we do that?
Yes.
Will you come with me and hand out business cards while I dance?
I absolutely will.
Come to Dayton, Ohio. Kettering Network could use some constructive input. Jennifer Dietrich. It's funny, in Ohio. Yeah. I'm going to be in Ohio in Cleveland Clinic Empathy Summit in June. I think June 8th or something. So come see me there. I'm all about Ohio. I've spoken in Dayton before, actually, for Upper Valley Medical Center a long time ago, actually, back when I was still learning to get my sea wings.
Yep.
Is that a thing? Sea wings? You're a Bostonian. Tell me about it. What's the deal with yachting? Do you have a yacht? Do you pilot a small craft?
No, I do not. I'm actually terrified of the ocean.
Would you ever throw tea in the harbor?
No, I wouldn't.
Yeah. What's it like having 3 kids, 2 girls and a boy, right?
Just rattled,
All
crazy,
the time.
All the time.
All day, every day.
Chaos, nonstop. But that meshes well with working with you. So it's nonstop chaos.
Yeah. So this is great because we're a yin and yang balance. Like Andy's going to be the calm professionalism that actually subversively gets into these big companies and shows them what 3.0 can look like and what we can do with this platform.
I see my job as really explaining to some of these old school, old guard mentality that may say, oh, you're just, a silly rapper kind of guy. I'm going in there to say, no, that's very 2D thinking. The 3D thinking is listen to the message in there that is getting spread to a heck of a lot more people in healthcare. And you need to pay attention, even if, at first you may not like it personally. Listen to what he's saying because the message is huge. And I see that as...
this is the secret thing because I am a bit of... it's hard sometimes for me to sit down and just tell people what we're really about because it feels a bit like it's a little self-conscious. Right. But Andy's able to express it in a way that I think is going to be very, very good for the whole platform Z-Pack and for all of us together. Off topic, says David Overton. Dr. Z, your shout out to our sick nurse made a difference. You brought a lot of smiles and hope to her and the awesome peeps taking care of her. Respect. Thank you, David. I remember that. And this is the thing, like in the end, this is all a personal thing for us. We all are, you're 38, I'm 45. We have had our middle-age crisis where we're like, what matters now?
Here I am. Yeah.
Clicking the boxes, like continuing to do what people think we're supposed to do and strive and do all this, or is it making an actual difference in the world for everybody from a sick nurse on the front lines to a whole sick system? And it's not us, we're just the catalyzers for your voice. And we want to give you a voice that's actually heard and that somebody actually does something about.
Yep.
And I think that ultimately is why. And when we did a big search for Andy, and when we met him and talked to him for the first time, we're like, yes, this.
I think the first question you asked me was, are you easily offended? And I said, at that moment, I knew that this is probably going to work out.
Well, you know, the last thing I need is another sexual harassment suit from a man.
Right.
Me three.
Yep.
Me three.
He too.
He too. I like that, he too. That's good. Let's read a couple more comments and we'll let Andy go down to the floor. I got to warm up my voice for the show today. Hey, I'm 45 too, sick of the present system. Tara Steinglass. Man, us 45-year-olds have grown up. We straddled the world of health 1.0, 2.0, and 3.0. We were there when the EHRs went live. We were there when they turned what was a relationship into a commodity. We were also there when we realized health 1.0 wasn't the bomb, man.
Right.
Like, there's a lot of problems. So we're not saying go back to those days. We're saying transcend and include the best aspects of what came before. But what comes next is a truly relationship-based, unique, team-based, supportive environment where we get to do the right things for our patients. I shared an article from the New York Times Magazine that I thought really nailed it with Dr. Meltzer out of Chicago doing incredible work on relationship-based medicine. And I think that's the bottom line. Yeah. Sarah Chuck says Bostonians are not easily offended.
That's true. We are not.
So do you see yourself as a Matt Damon or a Ben Affleck?
No, I think they both need to go away, to be honest. Take a break. We've had enough of had enough of both of them. But seriously, like, I want to know, is a doctor-patient relationship, does that even exist anymore? Every experience I've had in the past, 5-10 years, it's like, what happened when I could actually sit down with my doctor and have a conversation without them staring at a screen and just almost as if I wasn't there, Let's try to get back to it, as you say, and put that technology in the background to enable it, be evidence-based, but also feel like you're talking to a person who cares and isn't just checking the boxes,
I mean, that's you nailed what it is, the ethos. And I'll say this, it's not just doctors. Nurses now are so busy clicking boxes, so busy going through the steps. There's no longer critical thinking encouraged. There's no longer value. And so what happens is they're a click box on a balance sheet. They're no longer a human being that does the care that actually matters, that listens to the patient, that hears their unique story, that finds the parts of the story that actually matter, and then communicates with the rest of the team, including us, and says, you know what, listen to them, because they're saying this, and this is what really matters. And I think that is what we're trying to build. And it's about optimizing the technology and the EHR. It's not about throwing it away. It's about using it as a tool to get to the next level. We're in a boat right now called Health 2.0. We're trying to get to a shore. People get confused and they think the boat is the destination, and that's why we're failing. We need to look at the other shore and go, how's this boat going to get us there? Not, how can I optimize the boat? So that's what's going to be the sort of heart and soul of what we're trying to do. Andy understands it. And again, I think having worked in healthcare for so long, but not being a clinical practitioner, he has a perspective of a muggle, a non-medical person, and someone in the industry, and a consumer of healthcare, and a father, and a husband, and all these other things. So we're like, really, honestly, it's like a gift that we were able to connect with him, and he joined us, and it just proves to me that I think we're on the right track, Z-Pack. So send him your love, email him. If you're a potential sponsor, hit us up. And look at our dope little cards too. Yeah, show them. Yeah, I think yours are over there. Yeah, mine looks like this. And not bad, right? Logan designed them.
Anyway, throw my email, LinkedIn up there.
Yep. And
happy
we'll
to talk to anyone.
Yep. And other than that, we're gonna go get arrested in Texas, and if we need bail, we'll be hitting you all up.
Absolutely.
What do you think? What's the first crime we're gonna do? Jaywalking?
I don't know.
Can Andy rap? Stacy Gomez.
I cannot. I'm a straight up classic rock white boy. No rapping ability whatsoever.
This is an abject lie. The reason we hired him is he will quote any rap song to you.
Yeah, I'm actually a savant like that. I got all the words already down.
Yep.
So.
He's like the Rain Man of gangster rap.
That's it.
Like he'll just sit there with Jay-Z, 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 Biggie.
Yeah. Right.
Yep. It looks like I'm supposed to check in for Southwest.
Are we supposed to be catching a flight?
If we are, then it means I've misscheduled something once again.
Technology.
Z-Pack. Thank you to Andy Loynd, our new executive producer, biz dev guy, Z-Dog MD, San Antonio, Texas, and we out.